Hello, good afternoon. Welcome everyone. I'm Dr. Sridhar, and
Uh,
today the reason I wanted this session is to highlight a very important doctor. He is Dr. Mahesh Dutt Sharma, and I came across his profile as he's part of the neonatal ventilation course, and I had the fortune to meet him in person as well. And I realized that he has a lot of special qualities. So, Dr. Sharma, please introduce yourself. Welcome, and thank you for sparing the time.
okay. Uh, Thank you, Dr. Sridhar, for your kind word. Uh, Actually, myself, Dr. M.D. Sharma, Mahesh Dutt Sharma, as you told rightly. So, I am practicing in an area known as Mawana. It's a rural town. It's almost 50 kilometers away from Meerut and comprising almost 7 lakhs population. But the thing is that there is no good facility for medical care is here. Being nearby to the medical college, one CSC is here, and majority of the uh, birth are still deliveries are still conducted at home and by some ANM. So in this area, probably it's mine NICU that has been started almost 10 years back is the only center where the newborn babies or the sick babies are being cured or being cared. So this is because it's almost 36 years back I started my practice as a pediatric practitioner. And since then, there was a lot of development took place as far as the sophistication in this care is concerned. So starting from the basic level to the level which is really compatible to the higher center. It's a very difficult task, and but it's requiring a lot of support and then cooperations and encouragement. Just like you, Dr. Sridhar, you are such a person in this neurology. I should say that whatsoever my status is at this moment, it's almost 70% contribution is Dr. Sridhar's videos and the style and the convincing and the gestures that he spreads among all the newcomers and among the learning or the curious sort of neurology learners. So, as far as my workplace is concerned, I have around 10 NICU beds. Among 10, I have one to CPAP, HFNC, ventilation, conventional ventilator, and even I added one HFO also. So this is something that is compatible to any heart center. But as far as the X-ray, indoor X-ray and ABG is concerned, that we have already started installing them. So this is something that evolved during my last 10 years of my practice. Uh, be- but the only thing is that those who can afford, they can travel at any, they can afford to, they can reach to any bigger hospital in maybe Delhi or maybe in Meerut. So, but unaffordability is the very major issue, which is need to be tackled in a manner, because at the same time we have to give the better care also, and with the lesser cost or the unaffordability, as I told you, that the major issue. So we have to make them comfortable that without even expenses, it's a small, in big amount, your child can be saved. It can be so this sort of trust or faith has to be developed, and it requires a lot of dedication, devotion, efforts, inspiration, and mindset also. So this is something that I exercised And I should say repeatedly that in last 3 years, whatsoever sophistication I get, it's because of Dr. Sridhar's videos, watching and all. So this is something I wish that many new comers, they should also start doing the things with the spirit that unavoidable, the financial issue should not come in the way to give the best treatment in the way. So
Yes, and
this is
just a
because
quick word. I mean, you mentioned that. I mean, from our informal chat, you mentioned that you were one of the office bearers, I think the president of the local branch of the IAP as well, and that puts you in a leadership role relatively among the colleagues there. So, Dr. Mahesh, I mean, what I found most impressive, I'm going to break your secret. I mean, he's 68 years old, and the active learning he's doing at this age is highly commendable. And obviously, he's the oldest member in the Neovent course, and he has shown an incredible passion to learning. And I had the good fortune to speak to his family, who also confirm how committed. And the reason he's committed to learning is because he is in a position, as he said, that he has resource limited settings, the families who don't have anywhere to go. And he said billing is not his major concern. There are many patients, he does free treatment as well. And his reason to learn is to make sure he provides the right treatment to the patients, because he has taken the onus on himself to serve the community. So the passion he has are two. One is the service to the community in his region, which is resource limited, and he explained clearly that the medical college, not everyone is able to travel that far, and also the higher centers, if they're able to transfer again, it resource may be a limitation. So he has created a setup. He has worked really hard for it. Most of you who are working in such situations know how difficult it is to run your own unit. You have the family expectations, you have the sick babies who might deteriorate and who may not make it despite your best efforts. But he has taken education as his passion to help him in that challenge. And I'm very happy that, I mean, the YouTube channel or any other options I've created is helping people like him to learn more and ask questions and clarify. In terms of teaching his team, I mean, he said his nurses are well respected. He teaches them, and he has recognized that as a way to improve the outcome of the patients. And he's well known in his community. So, what the reason I brought him here is twofold. One is listening to him and his success story, or hardworking success story. It's not easy. And I mean, people have asked him why you're not retiring, why you want to work hard even at this age. And his answer is that we are here, God has brought us here for a reason, and we have to fulfill our commitment. So that's a philosophical way to look at it. And do you want to say anything about what keeps you going, Dr. Sharma? And he said he has a supportive wife, by the way. That's very important if you want to continue learning and working so hard. Yeah. What's your main advice to the people around you? I know updating the skills is not something that our clinicians do that well, and that initiative has to come from within you. The medical council doesn't push us. The American Academy, for example, needs you to take an exam for keeping your license every 10 years. And we have the CPD requirements, which you can get quite easily without really applying your brain or learning anything new. So the onus of learning should come from within you, as he has done, that you want to do the best for your family and the patients. And obviously, the reason he's learning is not because he would get the patients anyway. I mean, whether he manages them the evidence-based way, whether he ventilates the right way, he has a blood gas, he has an X-ray. We had the recent discussion where we discussed the resource-limited settings. So again, Dr. Mahesh, hats off to what you're doing. Do you want to offer any words of advice to the youngsters who are not still applying themselves as much to update them, and also the resource limitation, any tips for how they can overcome that?
thanks a lot, Dr. Siddharth, for that.
Do you want to give any tips or suggestions to the youngsters?
Pardon, sir?
Do you want to give any tips for the people who are watching you and how they can
Huh.
continue to
Actually,
replicate what you're doing?
actually, the simple tips that everyone knows and everyone accept the fact that for any good work, you need passion, you need dedication, you need devotion, you need energy, enthusiasm, everything, and they all combine together, and then your mindset and your intense desire to do something as it really makes all the difference. If you confine all your interest or efforts for your sake only, so it will satisfy only for a shorter time. But if your perspective is bigger, you want to serve a society, the needy people, the masses, then your self-interest goes away. Only thing that remains in your mind that you have not to take anything from others, but you have to give many things to other people. So this sort of principle, motto, or aim should always be there, because financial gain is something that can be achieved by it may be byproduct, but the main target or main aim, main motto should be serving the society. And those who are really needy, they should not be asked for any sort of payment, or you should make, you have the power, you are having the power to give them, either you make them free or make less charges also. So it's not the fixed charges that where every patient has to be asked for, but according to your own satisfaction, you have the right to serve the society rather than earning from the thing. This should be the aim at this moment, because earning may not be a limited factor, but your satisfaction by doing something charity, or some doing, just spreading the smiles on the faces of so many people, is long lasting and very contesting. This is my point.
And in terms of finding the time to learn, how do you find the time to learn amidst your busy schedule?
Actually, my timing is very short, because if, probably at this age, nobody will imagine that I go to bed around 2 a.m. and I get up around 6 a.m. And for those 4 hours, I go to sleep, and I have phone call in between also. And whatsoever I have to go through, it's the early morning time, maybe for 6 to 8 hours. I go through all the videos of yours and others, so this is my time. About I spend time for some concentration, for dhyan, for yoga, for exercise and all. So this is by 90% of my time goes to the
Patient.
hospital patients and other patients, and
Just a quick
10%.
comment on the equipment management and any tips for the doctors who want to start a setup like yours. I mean, how do you purchase the
Uh,
equipment? Or
Actually, the tips is that first your aim should be the cure of the patient. Give the comfort, give the pleasure, or the smile on the patient. Whatsoever efforts you are doing may be inadequate. You have to think about your own efforts to give more and more, to give more and more. This is the thing, rather than expecting and getting content with the efforts. You can stretch your stamina, you can stretch your energy, you can stretch your energy for good thing. So definitely God is kind enough just to provide all the energy for the sake of good work.
and
So
in terms of
this is,
purchasing the equipment for the NICU, I mean, do you
yeah.
have any suggestions? How do you go about choosing your equipment? And
Actually, initially I thought that finances are the major concerns, but later on I thought that spending in gadgets is not a something that you can compromise. But I purchased all the things, because I ventilator I purchased last night is the acutonic. It's one of the best one with
yes,
HF4, and my Fisher Packer's HFNC, and this
we'll see.
CPAP and all, these are branded. The same and ABG machines and all. To okay, this all these things I don't compromise
Yeah. And in
for the
terms of
sake of gadget.
retaining the nurses, I mean, you said you are
Uh,
interested in
uh,
teaching them as well.
yes,
How do
yes,
you
yes.
retain them?
Nurses are being trained regularly. So, infection control, people are here, so they take care of the infection control. The nurses are being trained in medical college, and then they are sent. And so many videos are being shown to them to upgrade yourself. And some surveillance team is also being called time to time here. And as far as the culture sensitivity part is concerned, in the nursery and ICU is regularly being done. And with the grace of God, uh, for so many months, no positive culture was reported from my NICU.
Okay.
And this is something that I have instructed all my nurses that major concern about the infection control. So they should not make any lapse for this thing.
And
Everything
breastfeeding
has to be
support, I
done.
mean, you have support for breastfeeding as well in your unit?
Breastfeeding, definitely, because my NICU is not very big one, a smaller one, and space is also not that much. So I ask EBM rather than breastfeeding, and the moment the newborn are discharged, then we just 1 or 2 days we call the mother to stay here and then get trained for KMC and this breastfeeding alone. So it's not routine in my nursery that mother visit for KMC since there are constraint of spaces and rooms and other places for them.
Yes, I understand
So
that. I mean, but I mean, it's a very important thing as well. And as you grow, probably you will find at least one room by the side where you can have this privacy for the mother, or curtains drawn for one space which is provided. But in terms of the quality improvement and things, you said you are looking at infection control, and as we keep saying, if you avoid the infection, half the job is done, because mostly the babies, the nature will take its course with the supportive treatment. So we shouldn't do harm, and I think infection control is a key, and retaining the nursing staff who are experienced by paying them appropriately, so that you don't lose out the experienced people, because experience is not replaceable. And recognizing that gadgets are not for compromise, the staff salaries are not for compromise. These are very important things as well. And you said you have a very tight schedule, and despite that, you find time in the morning before you start your routine to learn, and you teach as well. And you said you're using the videos to teach the nurses as well. So it was a nice experience interacting with you during the ventilation workshop. But in terms of the course itself, do you have any comments or feedback on that?
And as I told you in that PCS also, that this course is really so important and so informative and so pertinent for those people uh, who want to learn, who want to press or who want to recap the knowledge. And whatsoever practical things on the ventilator demo was shown, it's really practical and very useful. So you made the model so nicely manageable and very nicely framed sort of lectures along with the case presentations and along with the demos and all videos. Well, such a fantastic sort of organization of such a workshop. And I told at that time also, it's a single man or one man show where you took all the charge, right? So many people you supposed to do, but you did all the things on your hand, and then accomplish the things so successfully. So credit goes to you, and I should say that whatsoever spirit you have for the commitment as far as your passion of disseminating the knowledge and convincing it's you really, I mean, amazing. It's unmatched rather. I have come across so many people. I'm not exaggerating anything, but I have come across so many people during my last 60 years of my age, but very few, maybe 1 or 2 or 3% I came across with such a spirit, such a caliber, such a mixture of so many things in one person is really amazing. I feel fortunate that I met such a person whom I dream to have such person in my contact. So it's a
Very,
very very exciting, very new
very
thing,
humbling to hear
and
this from you. And I
very.
mean, really admire, I mean, again, the way you're able to put your thoughts. And I mean, I respect the way you have communicated and given the time for the others to benefit. So I hope this video will motivate more and more people to do more from what they are doing. Don't stagnate, and don't think that this is your level. As you rightly said, I mean, you had shared a short presentation. I can put it in the Telegram channel as well. So in terms of learning, there is no limit, and age is not a limit as well. And remember that you take the onus for learning. No one is going to be on your back looking at how you're practicing. So you have to set the threshold, put the bar high yourself, aim high. There is nothing holding you back, and have it in your commitment that you want to do the best possible care. Maybe what you believe as the best may not be the best, but at least you're trying to achieve what is best at that time as far as your knowledge goes. So we call it the best interests approach. So you are looking at the best interest of the family, and it's not about how much they pay you, it's about what you owe to them as a physician and the approach that you have. So again, congratulations and hats off. Please continue doing what you're doing, and I hope you can do local meetings. I mean, you're linked to the IAP and NNF, so if you do local meetings and educate people in your community, now you are very knowledgeable in many aspects of ventilation. Don't be shy. I mean, don't be shy to speak more, and obviously share your knowledge. More importantly, share your spirit. That's the most important aspect of it, and you should be really proud. You and your family should be really proud for what you're doing. That's why I immediately said we should bring this to everyone. And thank you, Dr. Mahesh, for sparing the time. Thank you.
Thank you, Dr. Siddharth.